Good day and welcome to Issues and Answers, a production of the Government Information Service. I am your host, Jacques Hinkson Compton. So Sunday, October 24 is UN Day, and with me to discuss this, among other things, are UN Country Coordination Officer, Dr. Lorraine Nicholas, Country Program Specialist of the Pan-American Health Organization, or PAHO, Mr. Reynold Hewitt, and Lilia Ramjeawan, Program Coordinator for the Joint Program on Social Protection. Welcome. So, Dr. Nicholas, let's start off with you. What exactly is UN Day?
Thank you for having us, Mr. Compton. So, United Nations Day, or UN Day for short, is really the anniversary of the creation or the establishment of the United Nations. The United Nations Charter came into effect on October the 24th, 1945. And so every year, UN Day is celebrated on the 24th of October. And so this year, 2021, marks our 76th anniversary. And UN Day across the globe is celebrated in various ways. You have many governments, many countries using this day as an opportunity to demonstrate and to reaffirm their solidarity with the United Nations. So for example, in St. Lucia has organized a flag raising ceremony where both the UN flag and the St. Lucia flag will be raised, basically as a sign of partnership and collaboration. And also it is an opportunity for the United Nations to celebrate and to highlight our achievements, our work, as well as to promote our core values, which has to do with peace, accepting diversity, equality, unity, and of course, human rights.
Okay, and thank you. So the next question is for you, Mr. Hewitt. PAHO, what is your organization's mandate? And because most people will not know too much about PAHO, so just explain a little bit about your organization.
Okay, so thank you for having me here this afternoon. So PAHO, the acronym means the Pan-American Health Organization, and we are a specialized international health agency for the Americas. We are also the World Health Organization representative for the Americas, and we work through countries throughout the region to provide or to improve and protect people's health. And this is done through engagement, through technical cooperation with all member states. So we work with them to improve on their communicable disease, non-communicable disease, to improve health systems and enable them to respond to emergencies and health problems. So what are our mandates? So we have strategic directions, and we have what is called the BWP, Biannual Work Plan. It's a 2-year program. We have just ended 2020, 2021, and we are going into 2022, 2023. And we have at least 3 focus areas for 2022-23, which is to protect, recover, and to build back stronger. So we want to protect the gains that we have made over the years in immunization, NCDs, disaster, and so forth. Recover, we want to recover the losses that we have encountered as a result of COVID, okay? You would agree that COVID has impacted a lot on the health system. So we want to recover from those impacts. And we also want to build back stronger, because you would agree with me that the health system was severely impacted. So we want to build back our health system stronger, and at the same time do not leave anyone behind. So those are some of our mandates, and we can break down those mandates into 6 focus areas if we choose to, but if time permits, we will come back to them in a while.
And Ms. Ramjeawan, can you tell us a little bit about the Joint Sustainable Development Goals, or SDG Fund program in general, and specifically about the Joint Program on Social Protection?
Certainly. The Joint SDG Fund program, it's a program designed to help globally countries to accelerate the progress towards the Sustainable Development Goals, hence SDG. So it's a multi-partner fund where we bring the different UN agencies, bring in their different expertise and knowledge, as well as different donor organizations, where we were able to pool the resources to help countries meet their progress towards the Sustainable Development Goals. The SDG Fund project on universal adaptive social protection in the Eastern Caribbean, it focuses on social protection because social protection cuts across several of the SDGs. It is also an established tool to help vulnerable persons, to help provide support to vulnerable persons. And as Mr. Hewitt mentioned, it is also fits into the UN principle of leaving no one behind. So this joint program on social protection is quite relevant for the Eastern Caribbean, especially in light of the number of vulnerable persons that we have as small island development states. We have the persons who get affected through natural disasters. People, they become vulnerable for several reasons. We have women who are vulnerable because a lot of our women are female-headed households. Children are vulnerable. Persons with disabilities are vulnerable. So the joint program is really just to help governments strengthen the systems to support those vulnerable persons. And we are implementing this joint program in two countries, St. Lucia and Barbados. And we are also supporting the OECS Commission so that the lessons learned from St. Lucia and Barbados and St. Lucia in particular can be scaled up to the other agencies. As I mentioned, in terms of the five, pulling together the UN resources, it's been implemented by 5 UN agencies, UNDP, UN Women, UNICEF, the World Food Program, and the International Labour Organization. It's a 2-year program, and we are supposed to end by March of this next year.
Okay, thank you very much for that. We're actually due for a break. Stay tuned. You're watching Interview. We'll be back in a moment.
In an effort to ensure patient and first responder safety, the St. Lucia Fire Service has reviewed its patient transfer procedures, especially for patients with respiratory distress. Face masks will be provided. At no time during transportation should the face mask be removed. Please be patient and cooperative during this time to ensure you receive the best possible care while keeping our first responders safe.
Hello and welcome back to Interview. We're speaking with UN Country Coordination Officer, Dr. Lorraine Nicholas, Country Program Specialist of PAHO, Reynold Hewitt, and Program Coordinator for the Joint Program on Social Protection, Ms. Lilia Ramjeawan. So the next question is to you, Dr. Nicholas. The UN has recently reformed. What does this reform look like, and how can St. Lucia potentially benefit from this new dispensation?
Okay, so every 4 years, the United Nations conducts what we call a QCPR, which is a quadrennial comprehensive policy review. And so, which basically means that we are taking stock of our operations with a view to identifying ways to improve and to provide better support and services to member states. So following the 2016 review, both the United Nations and member state heads of member states agreed that the achievement of this ambitious 2030 agenda would require the UN development system to change the way it operates, and not just any change, but some really bold and transformative changes, because the UN development system and the 2030 agenda requires a system that is more agile, that is more cohesive, and that is more responsive to the needs of member states. And so about 2 years ago, the UN was reconfigured and repositioned to provide more coordinated, more relevant, more responsive, more results-oriented support to member states to help them to accelerate their progress towards the SDGs. And so a fundamental element of that reform is the emergence of over 100 what we call UN country teams in regions all across the world, including the Caribbean region. And so what it means is that we are bringing the UN closer to countries. And these country teams are led by an empowered UN resident coordinator. through the resident coordinator system. So I work for the Barbados and Eastern Caribbean Resident Coordinators Office. And we are a multi-country office serving 10 countries. So Anguilla, Antigua and Barbuda, Barbados, the British Virgin Islands, Dominica, Grenada, Montserrat, St. Kitts and Nevis, St. Lucia, and St. Vincent and the Grenadines. Now, in the case of St. Lucia, the UN has technically for many years had a presence in St. Lucia because we have had at varying points in time agencies implementing projects and programs. So PAHO, UNICEF, FAO have at some point in time been on the ground implementing projects. But the fundamental difference now, Mr. Compton, is that we have a more coordinated system now through this resident coordinator system that allows us to deliver as one UN. And so we are now in a position where we have all the UN agencies in the region coming together as one to form what we call the UNST, the UN sub-regional team. And all of them are accountable to our resident coordinator. And by coming together as one team, we are now able to better leverage the comparative strength of the various agencies and to foster synergies that allows us to better respond to country needs, as opposed to what obtained previously, where you had UN agencies basically acting individually or in silos. And so now we are in the process of implementing what we call a country implementation plan for St. Lucia that captures the various projects and programs being implemented by the various agencies, and it is also aligned with the national priorities of St. Lucia. And finally, to end, I will say that another important distinction or benefit is that you now have the presence of a UN country coordination officer, who is yours truly, who is supposed to serve as a critical interlocutor between St. Lucia and the United Nations. Now, of course, I work for and represent the United Nations, but also providing St. Lucia with more direct, better access to UN-tailored program and policy support.
Now, COVID is quite topical, or has been for the past almost 2 years now. Mr. Hewitt, this next question is for you. Could you talk about PAHO's role in the fight against COVID, and more specifically, how is your organization in the pandemic? What is going on? What does that involvement look like on the ground in St. Lucia?
Okay, so from the get-go, we have been involved in responding to COVID in St. Lucia. And as part of the UN agency, we had what is called the Strategic Preparedness Response Plan, or SPRP. And on that plan, we have at least 10 pillars. So in order to serve the countries better, or to identify their gaps and to provide resources for them, we had these pillars. So under each pillar, we had command and control. With command and control, we assisted St. Lucia with the development of their COVID response plan. Okay, or in case, yes, they had the pandemic influenza plan, so they simply upgraded that to the COVID response plan. So we were integral in reviewing and updating that plan so that St. Lucia can respond effectively to the COVID situation on the ground. So we also had our risk communication. We assisted St. Lucia with developing risk communication plan, media cards for social media, PSAs for the media houses, and we also trained some of the staff in the Ministry of Health with regards to sending out how to respond to difficult questions that persons in the media would have asked about COVID. So we had communication risk. We also had laboratories. Now, it's very important that you have a strong laboratory when it comes to any kind of disease. So COVID was new to the region, and the laboratories needed to be upgraded. So we provided a PCR diagnostic machine to the lab so that they can run the various analysis to determine who has COVID from who doesn't have. We also trained the staff on how to run the diagnosis in the laboratory. And we provided PPEs over $449,000 worth of accessories and materials we provided to the government so that they can respond to COVID here on the ground in St. Lucia. We went further and we looked at surveillance. That's another pillar on the SPRP.
I just want to hold off for 1 second. We're due for another break. We'll just continue your thought when we come back.
All right, surveillance.
You're watching the Government Information Service. We'll be back in a moment.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join.
Excessive agrochemical use, additives, and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy, and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
Welcome back. We're here speaking with UN Country Coordination Officer, Dr. Lorraine Nicholas, and Reynold Hewitt, the PAHO, Pan American Health Organization Country Program Specialist, and Miss Lilia Ramjeawan, who is the Program Coordinator for the Joint Program on Social Protection. So yes, Mr. Hewitt, before we went on break.
Yeah, so another pillar that we looked at was surveillance. And surveillance is important for monitoring the cases in the country. So we trained the contact tracers. All right, so these persons were trained and they went out and they looked for persons who might have came in contact with an infected person. We trained persons in data collection, all right, how to enter COVID data into a software, and stuff like that. We also donated computers, thermometers, monitoring devices, and other equipment, and the surveillance persons, the contact tracers, they need PPEs. We also donated specific personal protective equipment for them. We looked at points of entry, the airports, the seaports, the marina. We also trained the staff there in IPC, Infection Prevention Control. We also provided PPEs for those persons on the ground when they interacting with cruise persons and persons coming entering at the airport. We looked at infection prevention control. That was very important. We think that our healthcare workers are very important. They are on the front line. So we wanted to ensure that they have the relevant information they need in order to assist sick persons or to protect themselves. So we trained them about COVID. We also trained them on how to use the personal protective equipment so that they can interact with sick persons. Because if your healthcare workers are not available, there will be no one to administer care to the sick persons. So we had to make sure that these persons are protected from the COVID virus. We also went further and trained persons in tourism, Ministry of Tourism. We trained the boat operators, the taxi operators, environmental health officers. We brought all of these persons together and trained them in IPC, and the PPEs that we donated, they got a portion to use while they're interacting with the guests, okay? We went further and we looked at the doctors. We brought the doctors together and conducted a special IPC program for them to ensure that they know what they're dealing with and how important it is for them to protect themselves. Case management, very important. How do you manage the cases when they come to the respiratory hospital? To manage the cases, they need to have the relevant equipment. So we donated a lot of ventilators, oximeters, that's finger oximeters, and a lot of other equipment to monitor the patients when they go to the respiratory hospital. So at the hospital, if you speak with the director, she will tell you how precarious and dangerous a situation can be when you have a lot of COVID patient present. So it was essential that we ensure that the hospital is properly equipped to manage these cases when they come to the hospital. And very important, if you can recall very early when COVID impacted St. Lucia, a lot of the services at the hospital were disrupted. antenatal care, outpatient clinic. These are essential services that must be running. Okay, so we stepped in and we said, listen, it's important that you maintain these essential services for the people who are out there, the disabled, persons with NCDs, mental health. So we ensure that these services were still offered so that persons can get the relevant care and treatment they need while managing COVID-19. So we were integral from the get-go to ensure that the health system continues to run and they have all the resources that they need to ensure, to improve, to maintain the health system and to respond to any emergency, such as COVID, in St. Lucia during this pandemic.
And Ms. Ramjeawan, could you talk about your organization and their aid in the fight of COVID?
Yes, well, the SDG Fund Joint Program, it is a UN-funded project, and it really it started in 2020 in the middle of the COVID pandemic. And the ultimate goal was to help St. Lucia to make its social protection system more adaptive. And that included making it more shock responsive. So whereas we started with focusing on linking social protection to disaster risk management, of course, now you have the COVID pandemic, we had to adapt. So working with the focal point ministry, the Ministry of Equity, we first reviewed the work plan of the joint program and we made some changes. We started first by providing some tangible resources, some cash transfers to 1,000 new households under the government public assistance program. So previously, the government funded 2,600 persons, but with our program, we supported an additional 1,000, taking that up to 3,600. We also provided cash top-ups to children with disabilities, children in foster care. That's over 500 children. We provided support for them. Cash transfers, and also persons living with HIV/AIDS. We provided top-ups to the food vouchers. So these are what the tangible assistance we provided to the government to help with the COVID-19 response. But in addition, given that the whole joint program is really shock responsive and adaptive, that's what is our design, we change some of the, instead of focusing totally on climate change and disaster risk management, we focused on some of the socioeconomic issues. So we look at the impact of COVID-19 on women, frontline workers. We looked at the impact of COVID-19 on monetary and childhood poverty. So one of the innovative things that came out of that joint program is a micro-simulation model. So the government can now go use that model, simulate. So if, simulate to say, if we raise transfers to the children by $300 a month, how is that going to affect the poverty rate? Will it reduce it? Will it bring it back to the normal level? So the government can use that to inform policy. We're looking at development tools and protocols to target vulnerable persons. And that's not only for COVID-19, but also for hurricanes as well. Who are the vulnerable? How do you find them when they're after a crisis? How do you link them to the social protection program? So these are the things that we're working with the government to strengthen also the institutional systems, creating linkages to the different social protection social assistance programs. So it's very comprehensive, and one of the key things that we do not want to leave behind is the evidence, because you have a dearth of data in the Eastern Caribbean. So we want to make sure that the government has the evidence to be able to inform policy and make the changes they need to the systems. And I'll give you a couple of examples. We have 2 pilot programs. It is not directly related to COVID, but it provides the evidence that you need to help strengthen your shock responsive response. So we have a pilot that we are working with identifying the persons who were affected in Hurricane Elsa. So the protocols and processes that were developed under this project, we use that to assess persons affected by Hurricane Elsa, or we're going to use that to identify what needs they have, their current needs, and how we deliver social assistance to them. So we're looking at identifying, targeting, delivery mechanisms across the board. We also have a very innovative program where we have providing support to 25 single mothers. These women, single mothers, on public assistance program, where we're providing them with skills training because they have difficulty finding jobs. So we're training them to provide them with basic skills to find job, whether it's hairdressing, basic accounting, but also we understand that these women have children in the home who require care. They have family that they provide care for. So we have provided them with cash top-ups so they could actually access daycare services for the children. And so we're looking at helping the government to strengthen all the systems that are required so that it can strengthen social protection, so the needs of all vulnerable peoples can be met. And of course, we cannot do that without financing. Social protection needs to be financed. So we are looking at budget assessments, developing and designing financial instruments so the government can identify additional financing and funding. They can work with donors to receive that financing, and also within their own budgetary system, where can you find money to support the social protection? So it's a very comprehensive program, and at the end of it, we anticipate that St. Lucia's example can be rolled out to the rest of the OECS and to help those countries strengthen the social protection. One thing I did leave out, which is also important, is that we are also looking at strengthening the legislative and regulatory framework, policy framework, because without that policy and legislation, you can't effectively implement your social protection framework. So we're helping and supporting the government in that way as well.
Yes, and your program sounds to be quite needed and impactful to St. Lucia.
Yes, COVID-19 gave us the opportunity to test in real time all the things that we are planning. So we know what the gaps are, we can identify what works, what doesn't work. So that was the silver lining.
So the final question, Dr. Nicholas, is to you. Going along the same lines if I asked the other two guests, how has the UN Eastern Caribbean Office responded to, as a collective, on COVID?
So our work in the Caribbean, at the UN, is largely guided by this cooperation framework, this regional cooperation framework that we call the MSDCF, the Multi-Country Sustainable Development Cooperation Framework, which is developed every 5 years via extensive consultation with our member states. However, as you know, and as my colleague said, COVID-19 hit in early 2020. And so we immediately recognized that we were dealing with an emergency, a crisis, and that we could not continue to operate as business as usual within this existing framework of this cooperation framework. We needed to go outside of that. And so we came together as one UN to launch this joint multi-sectoral response plan to respond to COVID-19 in the region. And it was designed to meet the short-term immediate needs in response to COVID-19, and it was supposed to end in December of 2020. It was launched in May of 2020. But even before December came, we recognized that COVID-19 was here, and it was here to stay, and it wasn't going anywhere. And so it meant that this short-term plan that focused more on immediate needs and more on strengthening the health systems that Mr. Hewitt would have spoken about, that just wouldn't cut it. Why? Because COVID-19 had evolved, it had manifested, it had mushroomed into a reality that was not merely a health crisis, but one with far-reaching socioeconomic repercussions. Persons were losing their jobs, children were out of school, and it meant that, as we say in the region, it meant that we had to wheel and come again. And we did that. We wheeled and we came again with an MRP 2.0 that was more responsive to the emerging realities and that focused more on responding or stimulating a socioeconomic recovery to the impacts of COVID-19. And I must say that this plan is not just a plan that is sitting on a shelf or a plan in our online documents. Through this MRP, the UN has been able to mobilize resources to the tune of $50 million to provide support to the arising needs as a result of COVID-19. And my colleagues would have spoken about the specific interventions, because at the RCO, we're really facilitators and coordinators. The agencies are the implementers. They are the ones implementing the specific projects as they would have spoken about.
Okay, I want to thank you very much for all your information and being on our program. You have something to say?
Yeah, we cannot close this program without emphasizing the importance of vaccination. Okay, as UN personnel, we want to encourage. As PAHO, I would like to encourage the population to go out and get their vaccination. Okay. They are available. The government went to great lengths to get the vaccine into the country. PAHO was there from the beginning. We're there when the vaccines were developed. Mechanisms were established so that the government can access at least 74,000 doses of vaccine. So we like persons to go out and get their vaccine so that we can get back to some sense of normalcy, and that persons can find a job, we can commence our travel, we can socialize, interact with each other. The vaccines are safe, okay? Very safe. They were adequately tested. So I want to encourage persons to come out, go to the health centers wherever they are, go to the vaccination site, get your vaccine before it is too late. We don't know what the future holds. But one thing we show off is that the vaccines are mutating, and persons need to ensure that they are protected so that whatever comes, it will not impact on them, impact on any of us severely to the point where we end up in the hospital. So please go out, get your vaccine.
Yes, thank you for that. That's a very important message from Mr. Hewitt. So thank you very much. And I want to thank all three of you for being on our program. Thank you for watching. This is the Government Information Service. Good day.
Thank you.